Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers, producer of Public Health on Call. Thank you so much for joining us for this season of the podcast. Our last episode of Season 9 airs on May 24th and will return to kick off Season 10 on June 3rd. Next season, we'll continue to dive into some of the biggest public health questions, like how worried should I be about bird flu, and how is access to methadone changing, or what's the story behind the surge in syphilis in the Midwest? Whether you're interested in the systems, science, or solutions behind our survival, Public Health on Call is your regular dose of informed discussion. A big thank you to our talented team of audio producers who spend hours editing every episode of this podcast. Thank you to all of our guests who lend their ideas and expertise to these topics. A special thank you this season to Nicole Germo, our practicum student. Finally, we'd like to thank you, our listeners, for sharing your ideas and questions. Please keep writing us at publichealthquestion@jhu.edu, and thank you for being part of this podcast. Today, the humanitarian crisis in Sudan. Dr. Salim Mohamednoor is a medical epidemiologist with expertise in emergency response. He's also the National Health Coordinator at the World Health Organization Country Office in Sudan. Just a note that he's not representing the World Health Organization in this podcast. Dr. Mohamednoor speaks with Dr. Josh Sharfstein about the unfolding catastrophe affecting millions of people as a result of armed internal conflict in his country. Special thanks to Aseel Salih, Hassan Salih, and Laila Zomorodian, Johns Hopkins Bloomberg School of Public Health students who assisted with the production of this podcast. Let's listen. Just a note that this episode contains depictions of violence.
Dr. Salim Mohamednoor, thank you so much for joining me on Public Health on Call to talk about the devastating humanitarian crisis in Sudan. Now, you're from Sudan. I would like to ask you to tell me a little bit about your country.
Well, thank you very much for having me. Sudan is a very beautiful country. It's the central of Africa, mix of Arab and Afros, a lot of culture, 7,000 years of civilization, linking the north of Africa to the south, east to west. And this is one of the reasons why we have a conflict, because it's a very rich country. It is the curse of resources and the curse of the gold, the water, the fertile lands, the Nile, the position at the Red Sea. All of this made us very vulnerable for such conflicts.
Let me next ask you about your job today.
I am currently the National Health Coordinator at the WHO Country Office Sudan, the focal point for migrants' health. And my current work is addressing migrants' health crisis in Sudan.
So we're going to talk about the dimensions of this crisis, which are enormous. But before we get there, could you take us back to 2023 and talk about how this started?
Well, unfortunately, the political climate by February and March 2023 was quite very congested in Sudan. And there were a lot of debates between the Sovereign Council and the aligned forces with the political parties about reforming the armed forces in Sudan. Unfortunately, this dialogue was not very successful, and it led to a sudden burst of conflict on the 15th of April 2023, where the Sudanese armed forces went into a direct conflict with the rapid support forces. And actually, this is how it started. And then Khartoum, the capital, is the pinpoint. Most of the military operations was there, though it didn't start there, but then it comes eventually on the 15th. And it then scaled up into this stage where more than 7.3 million people have been forced to be displaced.
This is essentially an armed internal conflict in Sudan with the population of the country in the middle. Talk to me about the number of displaced people and how people are becoming displaced, how they're becoming migrants.
As I mentioned, I started, it is 7.3 million people has been forced to leave their homes, either internally or externally. But definitely the majority of this number were in Khartoum state at the beginning, and then followed by Al Jazeera state later on in December 2023, January 2024, with 1.7 million people flee to the neighboring countries, 55% sheltering in northern, eastern, and central Sudan internally. And this is really very huge numbers. I mean, if you just compare them to population of countries, this is really huge. I mean, you can imagine a population of a whole country has been displaced.
Right. Sudan has only about 40 to 50 million people.
Yes, sir.
Correct?
Yes.
And so we're talking about the displacement of 7 million people. That's more than 10% of the country with no home, fleeing for their lives, essentially.
Exactly.
So let's talk about the humanitarian dimensions of this crisis. When you have 1.7 million people, you said, leaving the country, millions more internally displaced. What are the health challenges facing so many people?
Well, if we go before the conflict, that the Sudan health system was quite fragile. It was suffering to the knees due to lack of funding and lack of organizing the provision of services, and access to services itself. So it was really troubled even before the crisis. Now, when the crisis showed that 60 to 70% of the hospitals and health facilities in the affected areas were shut down due to that, not mentioning that they have been attacked themselves and destroyed. And the fleeing population put a burden on the settled states, where actually this put an additional burden to a very weak existing health facilities and services. So we see, for instance, the drug supplies went very, very shortened in the areas of settlements. There is a shortage of staff, medical staff to provide service. And also the beds are not there, the operation theaters and the specialities. Don't mention that Khartoum, as the capital, holds the biggest specialty hospitals, and they were completely shut down. So now there are patients who, with a bit more complicated diseases, they don't find suitable hospitals or facilities in the areas where they have been displaced to. So this is just the tip of the iceberg, to be honest.
Right. I mean, it's millions of people with minimal to no access to healthcare.
Yes.
What about food? Is there adequate food? Are you worried about a famine?
Yes, of course. Because of this conflict, the usual agricultural activities were stopped and shut down, and the import of grains and commodities also stopped. So whatever people are consuming is what is left before the war. And additionally, with the small production of the local market, there is and there will be a big famine if nothing has been done, or if what is going to be done is not enough.
And I imagine many of the people at risk are children.
Of course, they are the most to suffer, and the elderly as well. Not mentioning that the basic PHC services have been severely interrupted. Vaccination campaigns stopped. And that's why we've seen outbreaks of measles, outbreaks of vaccine-prevented diseases has been taking place within the areas with migrants or IDPs, let me put it that way. And the risks of infectious diseases became very high. We had a cholera outbreak, we had measles. I mean, there are so many outbreaks which shows up after that. Polio, for instance, shows up again. And this is really very devastating because we were about to finish from polio just before the war and to eradicate it. And now it's completely out of control.
That I was going to ask you about infectious disease. That is terrible. And IDPs are internally displaced persons. Is that right?
Yeah, and not mentioning that even the displaced population to the neighboring countries put another burden on them in areas where these countries, they were not prepared for that, not mentioning that the facilities which exist in the areas where the Sudanese refugees went were not prepared to receive them. So we find them in very shallow shelters with minimal health services. And this is another dimension of this crisis because you need to support even the hosting countries around Sudan, not mentioning the ones inside Sudan.
When you close your eyes and have a picture of the people who are suffering, I imagine you don't think of 7 million people all at once. What is that image?
This is an image of an old man has been shot to the head inside his house with his daughter being raped, and his house has been looted. As simple as that.
And the world does not seem to be paying attention.
It's huge. It really amazes me, not only me, I mean, all of the UN agencies and INGOs, that Sudan is really a forgotten crisis. I mean, people get too used to that Sudan is an African country and they've been suffering from these problems for ages. So our ability as an international community to adapt to this is what really makes me a little bit worried. Because with these numbers, I mean, more than 7 million people has been displaced with all of this demand and with the still currently going conflict, which it has got no limit. The children have been killed, women has been raped. I mean, this scale of violence is still not receiving the enough attention of the world. And I don't want to say it, but we are suffering in the dark. And this is quite very painful, not because I'm Sudanese only, but even if it happens anywhere else. I mean, it is our job really to put Sudan again at the top of the agenda, because if Sudan doesn't stabilize, even from the dimension of health and nutrition and so on, then the whole region is at risk. Sudanese refugees are going still to push out of Sudan, and they will need support. The governments of the neighbor countries will not really tolerate this, and they will need another support and so on.
Now, let me ask you, what needs to happen to support you in your work to help millions of people in this humanitarian crisis?
So what is needed now is acute or an immediate response with people, supplies, all the humanitarian supplies that we need now, the whole full scale of it. With people, I mean, we need even remote support and ideas and research and everything. We need everyone to contribute. Level of the governments, donors, academia, students, even ordinary people. I mean, if you can donate something, donate it. If you can talk to your local politician, talk to him. If you can offer your expertise to come down or even remotely to support, yes, do it. If you can raise money for us, no problem. I'm not begging for Sudan. I'm actually trying to raise the attention of the world about this crisis. But don't sit back and just let it happen, because there is something that everyone can do. That's my point.
I understand that one of the needs is for funding to support this response and planning that you're talking about. How is that going? Is Sudan able to raise the money needed so far?
Unfortunately not, because again, the conflict has been taken as an internal civil war or something like this. And then when you put it like this, then people start to take sides. And this is where the money stops to come, because definitely they will say, oh, okay, we belong to this, we agree with this side, or we disagree with this side. When you politicize and polarizing the conflict, people take sides, and then you fail to get any support. There is a crisis, there is a need, just do something about it. Instead of going into who's the first to fire the first bullet, or who is to be blamed, or the children whom they are dying, and the women whom they are being raped, and the people whom they have been killed, they don't have a title on their heads. I mean, you can't just say they deserve what they get. Nobody deserves what is happening in Sudan. Nobody deserves it, regardless of the reasons.
Do you have hope that the underlying conflict can get to a better place in the short term?
If we put Sudan again at the top of the agenda, we will get enough political momentum to stop the war. And that is very important. It will stop if it's becoming an urgent issue. It's at the top of the table. I'm not a politician. Unfortunately, politicians rule the world. We need them actually to acknowledge that there is a problem, which need to act fast and to help the people of Sudan, regardless of the reason, regardless of the political side. And there is a lot of need for money, and between two brackets, but money is not everything. If you can do anything, it will have an impact in this situation.
Well, Dr. Salim Mohamednoor, thank you so much for joining me today to talk to me about this absolutely horrible and forgotten, as you say, crisis.
Thank you very much. It was my pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.